When you hear the word marketing, what's the first thing that comes to your mind? Is it confusion, excitement, or frustration? You know, with so many marketing tactics out there today, there's a lot to think about. Also, depending upon the mindset of a potential patient in your area, which message and tactic would actually work best for them. Let's just say you have two separate potential patients in your area, but both are your ideal patient. One is not actively interested in your services at the moment, but the other really wants to schedule an appointment for one of the services that you offer. Well, which tactics will be the most effective for these patients? So it's really confusing. But today, I'm going to show you a simple way to put your current marketing tactics into a framework. And this way, you'll be able to visually see, which tactics have you covered for patients all the way at the top of the funnel and down to your current patient base. You can determine if there are any gaps in which tactics you need to implement, and this way it's going to help ensure a healthy patient funnel. This model, it's called See, Think, Do, and Care. First, we'll begin with the simple visual to our funnel. At the top of the funnel, we have our See audience. Who should see your practice? Is it male? Is it female? What are the age ranges? What are the areas around your practice? But these are the patients that would be ideal for your practice, but they have low intent to schedule an appointment, but they're also your largest audience. For example, let's just say there's a billboard on the side of a highway. A lot of cars pass it, everyone's going to see it, and at some point in time, everybody seeing that billboard might need your services, although not today. The next is Think. What do you want these patients to think about, when they see your practice? The Think audience are patients that are currently researching a procedure, maybe a service. They haven't necessarily picked a provider, but they are interested in a service that you offer. As we move further down the funnel, we get into our Do audience. What do you want them to do when it's time to schedule an appointment? These patients that have a high intent to schedule an appointment, they've determined which service that they want, and now they're really looking for the best provider in their area. The smallest area of the funnel is our Care audience. This is your current patient base. When you provide them with fantastic service, they're going to keep on coming back to your practice. But now that we've taken a look at the audience areas of the funnel, let's go ahead and match the marketing tactics for those areas. First, let's take a look at traditional tactics. Traditional tactics such as radio, TV, billboards, and print, they really dominate the top of the funnel. But this is also known as brand awareness. Direct mail stretches out to the Care funnel because you can also send a direct mail piece to your current patient base. Now let's take a look at digital tactics. With digital, there are multiple tactics that you can use to ensure that every area of the patient funnel is covered. You can, no pun intended, surgically place the appropriate digital tactic to ensure that there aren't any gaps in your patient funnel. Now, if we combine both digital and traditional tactics, you now have multiple channels that are going to cover your practice. Now, you may say, wait a second, Brandon, this all looks great, but my practice has nowhere near the budget to incorporate all of these tactics. Well, we at Netsertive understand that budgets are tight and overhead is high. So our experts will help determine which tactics are best for both your area and your budget. Now that you have a framework to work with, I invite you to use this and place your current marketing tactics in here, and this way you can see if you have any gaps. This is a great starting point, giving your marketing a healthy checkup. Do you need help? Do you also want to talk more specifically about your practice? We'll give the healthcare experts at Netsertive a call at 1-800-940-4351. Thank you.